We at St. Tammany Health System often talk about education, screening, and prevention. And today we're going to talk about a couple of ways you can do that and how we can help you do that. So joining me, first of all, is Dr. Brandon Brousse. He is a gastroenterologist with the Gastro group and Endo Center in Covington. And we're going to be talking about Colorectal Cancer Awareness Month, which is in March. So we definitely want to talk about this topic because, Dr. Brousse, you know, at the beginning, first of all, welcome and thanks for being here.
Of course, thanks for having me.
Yeah. So at the beginning of the year, we heard news outlets reporting that colorectal cancer incidences in younger people is on the rise. Mm-hmm. You know, those statistics came through several places, one of them being the American Cancer Society. So we know that colorectal cancer, you can do some screening things, you can do some prevention things. So we just kind of want to elaborate on that and talk about how we can do that. So first, let's talk about what is it? What's colorectal cancer?
So colorectal cancer usually involves cancers of the colon and of the rectum. That's primarily what we're looking for when we do things like colonoscopies or other non-invasive testing and stuff. Big thing why we want to look for it is it's one of the most diagnosed cancers in the U.S. and it's actually one of the leading causes of cancer deaths in the U.S. as well. Fortunately, I mean, we've had pretty good screening modalities, and we've actually seen over time that the incidence of colon cancer has decreased over time in older populations. But like you alluded to, we have noticed that younger people are now getting colon cancer at earlier ages, and that incidence is actually rising. It rose about 2% over the last couple of years back then. So that's why the U.S. Preventative Task Force and the American Cancer Society actually pushed to decrease that age of screening to start at age 45 instead of age 50 like it used to be.
Gotcha.
And I think there's been a little bit of catch up. A lot of people still come and see me and they say, well, I didn't realize I was supposed to come in at 45. I thought it was 50. So that's why we're really trying to make a push to get that education out there for people so that they understand that, hey, we really ought to start looking at this at a younger age.
Sure.
Try and catch things before they become a bigger issue. Because we do see that with colorectal cancer that if we catch it at an earlier, more localized stage, your outcomes are much better than once we start getting down the road. And unfortunately, when things spread, it makes it much more difficult to manage.
Yeah. So like we were talking about that, you know, the earlier screening age, and that is your screening colonoscopy, which is generally covered by your insurance, correct?
Correct. So just about every single insurance company out there gives you a screening benefit that basically covers your colonoscopy starting at age 45. Mm-hmm. Now, we do have some non-invasive testing out there too for people that are concerned about that. So these are all things that you can kind of discuss with us or with your primary care doctor. Okay. But the important thing is getting some kind of screening at age 45, and any colon cancer screening modality should be covered starting at that age.
Okay, so let's talk about the younger population, say under 45, which we're hearing reports about the increase in. What are some symptoms, I guess for anybody really, not just the younger population, what are some symptoms that maybe I would see or someone would see that would raise a red flag and have them call their primary care or call you?
Sure. So there are certain red flag symptoms we look for in anybody. So things like bleeding. Most people attribute this to things like hemorrhoids or something just kind of happened that it went away on its own. That could be the first signs of it. It may just be as simple as hemorrhoids, but we can't tell you for certain without investigating it further. So that's an important thing to ask about. Iron deficiency anemia, which is a common problem, especially in males. Iron deficiency needs to be worked up at any point just to kind of figure out what's going on there. Changes in bowel habits are important. So if you're one way and then all of a sudden you're noticing things are kind of different in the bathroom than they used to be,
right,
that can be a sign. It could be just a temporary thing, but certainly if it's ongoing, it's something that needs to be worked up. And then things like family history are important as well. Okay. So family history does change the timing of it depending on first degree relatives that have been affected and what age that they were affected at and such. So it's important if you have those risk factors that you go talk to your primary care doctor, because even without those red flag symptoms, unfortunately, we find some asymptomatic patients that are developing problems or having issues, and we go and we need to go look. So it's important for any of those things that pop up that you discuss with your provider, or we're happy to talk with you about it.
Sure. So a lot of the things, colorectal cancer, all the things that happen with bodily functions, it can be intimidating to talk to anyone about it.
Sure.
But what can you say to people just to kind of calm their fear of, say, embarrassment, or I don't want to talk about it, it's embarrassing, and they're going to judge me or whatever. But what would you say to people?
So I'd say the biggest thing, obviously nobody likes to discuss these things. It's kind of within our social norms not to discuss this. It's considered uncouth, but that's why we're here, is to discuss those things. That's why me and my partners, we've trained years and years to discuss this stuff in a professional manner, and that this isn't something to be embarrassed about. This is something that everybody does and everybody has to go through. So surely I know it's hard to kind of get over that hump, but truly, we're here to help you. And I think that's the most important thing, is realizing that this isn't something to be embarrassed about. This is something that's important. And honestly, the little bit of embarrassment you might get now could potentially save your life in the long run.
That's the bottom line. It could save your life. It's a health issue.
Exactly.
So we talked a little bit about some of the things that you can do for screening. So let's talk about the recommended screening tools. Of course, the colonoscopy. So we talked about this before we started taping.
Yep.
I have a friend who's about to have her first colonoscopy.
Sure.
And she's like, what do I expect? So I had my first colonoscopy a few years ago. Terrified, as far as, I was more terrified of the prep than the actual procedure.
Correct.
And it turned out it was no big deal.
Yeah.
Really. So can you talk about what the colonoscopy is? What's the procedure?
So
what should people expect?
There is a little bit of legwork, like you talked about, but overall it's a pretty easy process in general, I'd say. Day before your procedure, you have to be on a clear liquid diet that day. So it's not quite the best diet, but you can still have some stuff. You can have Jello, broth, popsicles, snowballs even, black coffee without creamer, anything basically that you can do. And most people often ask me, can I work that day before? And I tell them that if you're okay to work on a clear liquid diet, then that's okay. You can go to work that day. That evening is when you'll do your prep. We do have a number of options out there these days. I know everybody thinks of the giant jug. That's kind of intimidating,
right.
But that's certainly one of the choices. But we do have some other options, like some smaller volume preps or some pill preps. Ultimately, I tell people all roads lead to Rome, just different ways of getting there. But you will have to clean out, because the next day when you come in for your procedure, we are putting a camera inside of you to look. So if we don't have good looks, then we're not going to be able to see what we need to.
Gotcha.
So I know it's a little bit of legwork, but in the long run, it benefits you. Next day, you'll go to wherever your procedure is being done at, either at a hospital or an ambulatory surgical center. You will need somebody to drive you, because you do get sedation for the procedure if you choose. I do have a few people that choose to do it unsedated, but I'd say the majority of people want to be sedated for their procedure.
Yeah.
We use a medicine called propofol. It's a very easy sedation. It's very fast on, fast off. We always have a CRNA that's there that's administering the medication. We're watching their vitals throughout the procedure. No breathing tube involved. It's just a nice, peaceful nap. You're breathing on your own. Most people say it's the best nap of their life. While they're asleep, though, we take a long, flexible tube with a light and a camera on the end. It goes up your bottom. It goes all the way to the end of the colon, and sometimes we'll go into the end of your small intestine.
Okay.
And then on the way out, we look for anything abnormal we need to biopsy or take out. And depending on that, we tell you when we would like you to come back for surveillance.
Gotcha. So about how long does the procedure take once you are sedated and it starts from start to finish?
On average, about 20 minutes or so, give or take a little bit of time. It also depends on things like your personal anatomy. We're all made a little different.
Sure.
Or if we do find something that we have to intervene on. But I'd say on average, most people should expect to be in their procedure for about 20 minutes or so.
And really, the discomfort is on the front end as far as the prep.
Yep.
Once it's over, go have breakfast, pretty much. Right?
Exactly. That's what I tell everybody when they come in to see me. I tell them you've been through the worst of it. Now you just get a good nap, wake up, have your procedure done, and then pick out something, dream of something good to eat after.
Gotcha. Okay, perfect. So we're going to briefly talk about another screening option, which is a FIT kit. It's an at-home test, but just briefly touch on it and tell folks about that.
Yeah, so FIT, it stands for fecal immunohistochemical testing, which it's a lot easier to say FIT, of course.
Yeah.
But basically, these are some non-invasive screening modalities. FIT's the only other first line of screening that we recommend. So it's FIT test or colonoscopy.
Okay.
And basically it's a test, like you said, you bring home, so you don't have to go sit in a lab and try and do this in front of somebody or anything. Bring it home, they give you instructions on how to collect the sample. You turn in, it's basically a little card, you put a little fecal sample onto, you return to the lab, and then they run it to look for DNA markers for stool that could be with polyps or colorectal cancer. And if it comes back positive, then that's an indication that, hey, you really need to have a colonoscopy within the next 9 months.
Okay.
To go look for whatever caused that test to be positive. Now, any screening test isn't going to be perfect. Certainly things can be missed, or it can be positive and then we find nothing.
Right.
But it's we want to basically cast as wide a net as possible to get as many people in to figure out what's going on.
Okay. And we did talk a little bit about the fit kit and the fact that if you do choose that route, make sure you check with your insurance first to see what your coverage is, and if there is a finding, what your coverage is after that, because that is an important factor in your decision on which way to go, right? To get screened.
Correct. Yeah, we've had a lot of patients that are going for the non-invasive route. Understandably, people have concerns about sedation. No procedure comes without risk.
Right.
And certainly the colonoscopy is low risk, but it's still more risky than doing a non-invasive test.
Sure.
I will say to people, though, that any screening modality is going to be covered, but it's a question of, if you get a positive test, what is your coverage going to look like after that? So I do think it's important that people talk to their insurance before choosing one of the non-invasive routes, if that's the way they're looking to go, for if a test does come back positive.
Okay, and so before we wrap up, I want you to talk to us about anything you can do to possibly prevent colon cancer. What are some preventative measures I can take every single day with the choices that I make?
Sure. So I would say that the number one thing is getting screened at the appropriate time. So whether that's at age 45 if you're average risk, or if that's at a younger age if you have family history. Primarily, especially those people with first-degree relatives, really need to be coming in sooner, whether it's at age 40 or 10 years younger than the earliest diagnosis in their first-degree relative. So that's mom, dad, sisters, brothers. So if one of them has been diagnosed, it's really important that you talk with your providers. Screening is the number one thing, because what we can do is go in and remove problems before they become a bigger issue, or identify problems if they're already there. So that's what I mean when it comes to like polyps and stuff when we go to remove those, is preventing that progression. Things you can do, obviously, outside of screening, I'd say having a healthy diet is pretty important. A nice high fiber diet is critical. There's no specific diet that I tell people to go on, but generally a lot of people stick with like the Mediterranean diet, or other just general balance of fruits, vegetables, lean protein. Try to reduce your processed foods as much as possible. Certainly we've seen a rise in colorectal cancer screening over the years as processed foods have become more readily available, and that's considered to be possible risk factors for why we've been seeing that increase. So nice healthy diet, active living, active lifestyle, so making sure just the general kind of healthy things that you would normally do. But like I said, the biggest thing is just making sure you get some form of screening at the appropriate time.
Perfect. Well, thank you so much. And if you would like to learn more from Dr. Brousse, obviously you can find him at the Gastro group and Endo Center in Covington, but he is also hosting a virtual Lunch and Learn Tuesday, March 19th. So if you want more details on that, you can go to sttammany.health, and we will have details there. And we have other screening and education opportunities that are going to be happening throughout the month of March. If you watch our Facebook pages, Healthier North Shore Facebook page, you'll learn about some resources and tips. So once again, thank you so much, Dr. Brousse, for joining us. And we will be right back with Healthy Living.